Hello everyone, this is Shad Reis from CVI 2024. I'm really privileged to be with Krutarth Pandya, who is one of the people I work with them closely, but also he was one of the presenters with the research posters at the CVI. Welcome to KP to the meeting.
Thank you. Thank you so much, Dr. Reis, for this opportunity.
This is your second time.
This is my second time at CVI, yep.
And congratulations for coming again and presenting your science. So tell us first about your conference, about the presentation you did at the...
Sure. So my topic of interest has been overall cardiogenic shock, and that's what I worked upon. So this is the project I presented is on the MCS, that's mechanical circulatory support devices. And we looked at the patients who had the CKD and compared them without the CKD and looked at the outcomes. And that not essentially, just the cardiovascular, we looked at overall. It included the cardiac arrest overall. Of course, those patients are high risk. We looked at the mortality, the length of stay, and also we looked at the heart overall, kidney failure, heart failure, and the same patient having respiratory failure requiring ventilation and invasive ventilation, those things. And we did find most of those findings, including the length of stay, the respiratory failure, and also I think something else we had, the mortality was equivocal, but most of those findings are showing a trend that they have worse outcomes compared to the patients who did not have the CKD, which in a way we can think that you would imagine because they are the sick population. Anyways, they are sick, they are requiring MCS, so that's to begin with. And in addition to that, if your kidneys are also compromised, of course, it does not help. It leads you to the multi-organ failure relatively fairly quickly rather than the other population. So that was the main reason we looked into that. We never could find a strong evidence to support that so far, and that was the reason we looked into the NIS database, which is a national inpatient database. We had about 7,000, close to 7,000 patients that we found who had the CKD, and compared with the other half, which was I think close to 60,000 patients, the other half, and having those robust numbers helped us to have those significant findings that we can now, with an evidence, say that yes, these are the sickest population that we should be even more aggressive about and try and find solution, optimize them as earlier than later, probably CRRT, introducing it earlier than later. Those are some of the things that we can potentially look into and have a relatively better outcome than we would have otherwise. Something we can look into the further studies as well.
Important findings. Again, as you said, it's maybe it's predictable, but again, important finding and say that this is a sicker population. Even that will help with patient selection.
Yep, exactly.
When you bring them to the lab,
yeah, I had really great feedbacks. I was having discussion with other visiting faculties here as well at my poster, and we were talking about how the CKD can impact this patient. It's not just about the renal failure. There are other things that these patients are at risk for as well, including hypercoagulability, having the CKD, advanced CKD and stuff like that. It's just a lot of other things that can affect, which we don't know yet, which are yet to be explored. So this is just first step into this field, and I think in realm there is so much to explore. We need to figure out more which CKD stage these patients would have significantly elevated. If we look at the curve, we don't know yet which stage of the CKD would put the patients significantly at higher risk compared to the stage below that. So we don't know. These patients were included all of the stages, but that's something we can look into that in a maybe local hospital-based database and look into that further.
Data
exactly.
Them,
that we have more information. Yeah.
Well, great study, very, very insightful. Congratulations for presenting at CVI, and hopefully we see you again next year.
Sure. No, this meeting has been exciting for me since last year. I was here as well. I was at Austin, of course, when we had the conference. I'm excited to go back to Austin next year in July, and this is a great stage. It's not just interventional focus, but I think the way the field is expanding for the interventional cardiology, it's incorporating the heart failure aspect, it's incorporating the structural and many other things, cardiac ICU aspects. So I think those are very encouraging, things for the trainees like me to look into other things and into cardiology as well, how things are getting more specialized. Last year we did not have the interventional heart failure track. This year we do, and I think that's something, the need of an hour, how the field is expanding, how it's such a niche population. We are going down and down, more and more specialized it's getting. So it's so exciting to see how they are incorporating at CVI. Dr. Banerjee and the team, they have been all phenomenal in these things. I was just having a talk with him earlier, and I'm so excited for next year as well.
Yeah, I'm glad you had a good time, and congratulations again for presenting the poster. Please watch these videos and others on the YouTube channel. This is Shad Reis from CVI 2024.